Well,
One of the things that we think about is that people often think of putting in interventions in place. And so, in terms of abuse, you would intervene early if you found that the child had been abused or neglected by their parents. And that's the way our Child Protective Services system was initially set up. Call-ins, identification, referrals that a child was suspected of having been abused or neglected, and then there'd be an investigation. The parents would be charged, and they would be punished, and the child might be taken away into another house or put in foster care for a while, maybe adopted to elsewhere. And that was the early intervention. The earlier we could intervene, the better. But preventionists for years have said, well, rather than picking up the bodies downstream, let's go upstream to where they're getting thrown into the river and try to intervene at that point and keep the problem from developing in the first place with better parenting education, better kinds of supports for parents who are stressed, the knowledge that one of the things that can cause neglect is perinatal depression. Let's screen moms for depression and help them if they're showing signs before they show the signs by doing something that everybody will regret later. Let's know that this child who was abused and neglected as a child has and is now having a baby is at higher risk for having a problem, and help them to break that cycle, to get the information that they need to know why that's not appropriate and what other behaviors better serve the development of the child and of their family.